Hi, it's Jessica DeMassa with WTF Health. What's the future health? We are talking to all sorts of health innovators about what is going on in the healthcare system as a result of COVID-19. And joining me right now, I have Kirstie McCool. She is the Executive Director for GuideWell Innovation. Kirstie, it's a pleasure to have you with us.
Oh, thanks for having me. I'm so appreciative.
So a little bit of context before we jump into the news that we want to talk about with you in particular is I want to just do a little bit of a talk about what GuideWell is. So for those who may not be aware, GuideWell is the holding company for Blue Cross Blue Shield of Florida, aka Florida Blue, and then there's a number of other companies within GuideWell. Can you speak to those at all a little bit, just real quick?
Absolutely, yeah. So GuideWell is actually a national company. We're in 35 states all across the U.S. And so in addition to our Florida Blue subsidiary, which is one of 5 business units, we also have GuideWell Health, which is a network of clinical assets across Florida and then now expanding into other states. And we also have GuideWell Connect, which is a conglomerate of companies that do a lot of back office support and call center support for several other Blues. And then we have a couple of other JVs as well that are part of our clinical network, as well as some of our population health solutions.
So yeah, an expansive healthcare delivery, healthcare innovation company. And we're talking today about something that you're part of the organization is spearheading. It's the COVID-19 Innovation Collaborative. So tell me a little bit about this, because this was launched a couple weeks ago, and it has an application deadline coming up on May 8th. And so as we're in the home stretch of this, give us a summary of what this is.
Great. So Jess, as you know, I spend a lot of my time these days looking at sourcing and getting to know health tech companies in a variety of different domains. We've run several challenges over the past year on things like aging in place and caring for caregivers and stuff like that. And so when COVID began to rear its ugly head, I started getting, and I'm sure you probably got this as well, but a lot of emails and outreach from, digital health companies going, hey, I've got a really cool solution that solves X. And then another one, hey, I've got a really cool solution that solves Y. And all of these companies, and I'm super passionate about innovation in health tech, and I think it's critical for the future of healthcare. But as you know, many digital health tech companies, especially those in the early stage, are very, very pointed in their solutions. They're very targeted, they're very niche, which is exactly the right strategy they should be taking as a young company. But when we're trying to deal with, us as a large payer in finding comprehensive solutions around the needs that were coming up around COVID, we were looking for more comprehensive approaches. So I just decided to just put the collaborative together as a little bit of an experiment to see if this could work. So this is very much a hypothesis-driven program or process, but the thought was, why don't we come up with a really cool way, a vehicle, if you will, for all of these health companies or health tech companies that were coming at us to come together. So that instead of having a point solution here and a point solution there, we could potentially help them create a more comprehensive portfolio around their areas of domain. And so it's really all about connecting and convening and creating collaborative opportunities for these companies, and then also accelerating their access, not just to GuideWell, but also to a lot of our partners, other Blues, some of the providers in our network. So it's very much a loosely coupled collaborative kind of an approach that we're taking, but it's really about sourcing, vetting, validating some of these health tech solutions, finding best-in-class solutions that we can potentially bring forward into portfolios that address 5 critical areas that we thought were pretty important with respect to reducing some of the stress factors around the COVID pandemic. So
I love that. I love the innovative approach around this. And I think 2 things, I think number one, for being a very large enterprise, it's important. The complaint that you usually hear from startups is, I don't know where to start. I don't know how to get in there. Or it's like, if they do, it's like they get lost in, either the red tape or just the myriad of departments they've got to talk to. So I think this is a very clear pathway in for a lot of these early stage startups. And then I think on the other side of that too, as you had said, is the fact that, some of these solutions are either point solutions or they can take care of a very niche thing, or it's just by virtue of the startup size are too small to achieve the scale that you want them to. And so bringing them together, to collaborate I think is a really smart idea. Explain to me a little bit more about the 5 different categories that you guys are tackling. And one of the things that struck me about this is that while they are COVID related, now it's like, it's very easy for these things to like transcend COVID. So it's like, they're not so specifically, some of them are not so specifically pandemic related. It's like, these things could be put in place for the long haul. So tell me a little bit about those categories.
Absolutely. And we very much did focus on just critical gaps and things that we were seeing arise. And as you know, this happens so fast, Jess, right? And so it was like, okay, what are we seeing as the urgent critical needs? And so that's what these categories are around. So the first one is home-based self-test solutions. And I think we can all agree that testing is our new norm. It's not going away. So the faster we can come up with ways to quickly test large populations of people, the better. So that's the first category. The second one is virtual in-home care solutions for at-risk populations.
Yeah, and again, that transcends COVID to me.
Totally. And I think there's opportunities for this stuff to come into play in the long term. But for right now, we've got a lot of at-risk populations that, have diabetes and chronic health, heart disease, and many other complex or multi-channel sorts of health problems. And so it's very risky for them to leave their house, right? So we're looking for, solutions where they can be cared for in their homes with some of these, high risk kind of disease states. Next, we're looking for solutions that increase the safety of our healthcare providers. As I mentioned, we have, people always think of us as a payer, but in fact, we have a large network of provider solutions as well, and clinical solutions. Mm-hmm. So we have a pretty significant subset of our own employees that are at risk in clinical settings. And then, of course, there's our provider networks and those of all the providers across the U.S. that are doing great work. So we think that's a really important category as well. The fourth one is social isolation. There's just, I think it's well documented in the press right now that the mental health side of the COVID pandemic is growing every day. It's becoming more and more problematic as this goes on and on. And so for us, mental health and behavioral health has always been a critical focus area for us. And so we want to find solutions that can help address the mental health side of being socially isolated. And then our final category is one that's very near and dear to my heart. Not that they all aren't, but this one is particularly so. And this is around social determinants of health. So things like food insecurity, getting access to healthcare if you're in an economically disadvantaged neighborhood where maybe the transportation systems got shut down as part of COVID. And so that's a broad category, but a really important one, I think. So. Yeah,
I think that's one that there's just, in a couple conversations I've had earlier this year and at the end of last year at a couple different conferences I was at, there was a lot of chatter about how, innovation should not just be, I think Andy Slavitt said it to me in an interview I did, was that innovation should not just be for the Peloton crowd, that healthcare, really has to focus on solving some of the broader challenges for those that are, typically underserved and that may, not fall into that more affluent socioeconomic status.
Absolutely.
So, and I think like pushing on that is really important right now, in particular, especially as we're seeing, how the pandemic is taking hold and how some of these communities that are less affluent than others are much more at risk just by virtue of their living situation, having more people in their homes with them, things like that. So the categories we walk through, I want to talk about a little bit. So like I've been, I've been helping promote this challenge on social media, and I've been getting some questions back. So I want to ask you the 2 most common questions that I've been getting from some of the startups that have been reaching back out to me and wanting to find out more. So one of them is about this aspect of like combining them with somebody else. So my understanding and like the way it works, chime in here, but I get it that it's, the startup applies, they get selected. It's like you're selecting a certain number of startups. I think it's 3 to 5 per category, and then they're to work together to combine their solutions. I guess talk me through that. What does that look like to you? So like the startups that are like concerned about like, all right, so I've got to build something brand new. Like how does this work? How do you see this working, Kirstie?
Yeah, I think combine is way too strong of a word, Jess.
Okay.
It's an experiment-driven approach we're taking, but when we put the call out for these companies, the intent was much more of a loosely collaborative dialogue between them, where they've got to stay afloat and do whatever their core business is. We sure don't expect them to to take a very small amount of funding we can provide, which we'll talk about in a second, I assume. But, really we want them to just, make an effort to reach out to each other, to figure out collaborative ways they might approach a market opportunity together, or, approach the category as we've described it in the collaborative. But there are these categories are so broad that we're going to just leave it up to the companies to come back to us with, hey, what if we did, we went about it this way, we could solve this differently. So it's really more about collaboration than it is about requiring them to integrate their services.
Okay, so everybody stays their own independent superhero. It's just the team of superheroes can come together and work together as needed. Okay, I got it.
And it could even be in certain cases, and I'm not making this commitment at all, but it could be with the right set of companies that we actually create the portfolio on their behalf. So we offer up a portfolio of services to our provider networks or our members or whatnot based on what they have. So.
Okay, that clarifies that. I think that brings some anxiety level down on their part.
Oh, good.
The thing I get asked a lot about, and because anytime you throw this phrase out there, I think startups' little ears perk up. Non-dilutive funding. Talk to me about the non-dilutive funding here. It's like, what?
Those little startups should be thrilled that it's non-dilutive.
Oh my God, they are. Their little ears perk right up. And they're like, wait a minute, this is a payer that wants non-dilutive funding they're going to give me? Hold on a minute. So I think there's a little bit of a sense like this is too good to be true. So tell me a little bit about the decision there. Why to go that route? Because it is atypical for a payer. Usually kind of the model has been so far, the more common approach has been the payer will come, the payer will make an investment, and then it's like, the startup that they've decided to back is the solution that they then trot out. But I mean, this is different. So what was the thinking behind this decision to go non-dilutive?
So again, this is a collaborative. The intent here was not to find strategic investment opportunities in a crisis. It was absolutely about, bringing companies together in a collaborative manner. So the funding it's not going to be a lot when you spread $125,000 across somewhere between 15 and 25 companies. We're talking 5 to 10 grand each. And so we put that out there because we know that it will cost them something to spend time on this. So we're asking them to, take a little time out to, connect in with their peer cohort companies, think about ways maybe they could work together, again, informally, but still do that. And we just want to make sure that we let them know that we're asking a time investment at a minimum of them to potentially have those conversations. And we want to help them cover those costs. I used to have my own startup. I understand that time is money and how expensive it is, to divert your very small staff to look at something like this. So we just wanted to help them out.
Yeah. And I mean, the opportunity for this, I think, is, the opportunity to not only work together with other startups that are working on similar, areas of transformation within the healthcare systems, but also to, work with GuideWell and to have access to all of the myriad resources that you guys provide, not only in terms of, potential clients, but I mean, just even expertise.
Well, there's that. And I just also want to articulate that, our intent and hope is that we can help these companies, with their own businesses, right? And so it's not just about GuideWell. Again, this is truly a collaborative. So I just want to keep articulating that. So GuideWell, obviously we decided to do this. We put the stake in the ground. We're doing our part to try to convene, some of these companies in a I guess a collaborative way. But we're also planning on, bringing in, and we're talking a lot, or at least I'm on the phone. In fact, I was yesterday introducing this to, the other Blues across the country. And there's interest on their part in learning about the companies and potentially exploring, how they might be able to pitch in and help as well.
Awesome.
So, there's a lot of collaboration behind this, partners, payers, and some of our provider networks also are interested in, especially the clinical ones, right? Or the clinical solutions. I mean, our provider network are going to want to look at those too. So we're here to try to help the startups at the same time. We're asking them to maybe come together and think more strategically about how they could address some of these issues that are out there with COVID.
And I think the time is right for this because I think, as we've been watching the pandemic kind of take hold and then unfold here, and, where we're at right now, at the beginning of May, we're looking at kind of, I think everybody's got their eye on what's next. and where things are headed. And so, I mean, within this last couple of weeks that everybody has been under self-quarantine or in shutdowns, we've watched as healthcare has moved more virtual. And, it's been exciting for me, to talk to a lot of the folks that I know who have been working on telehealth or remote monitoring or different digital health applications, for the last couple years, and see them actually gain a lot of traction really quickly. So, I mean, I'd love to get your input, Kirstie. From a big payer organization, that's got its hands in care delivery, it's got its hands in innovation, working with the Blues. What do you think is next for virtual care and for telehealth, remote monitoring, the whole digital health space? What are you looking at as what's coming down the pike next?
Yeah. Well, I wish I could be had my crystal ball out and could answer that question perfectly, because I'd be really probably not here talking to you. I'd probably be up on an island of my own at this point. But
you'll have invested into things. It'll be fine.
Yeah. But here's the thing. Let's just kind of back it up for a second and just think about how fast things changed in the last, say, 2 months, right?
Yeah.
And just a couple months ago, there were a lot of PCPs and smaller doctors' offices that didn't even offer telehealth. And then COVID hit. And it's just been amazing to watch the transformation of our entire industry to telehealth in like 8 weeks. I mean, think about that, right? And so that's actually a really cool thing. And, I don't know, I doubt a lot of them will back out of it when it's over, because they just got exposed to it. They realize they can serve their patients through that communication vehicle and still be a highly effective healthcare provider. So that's really cool. And that's a nice baseline to start with to answer your question.
Yeah.
But I thought I'd put some numbers around that from Florida Blue. So before COVID, and we use Teladoc as our telehealth vendor. And there's a lot of other amazing vendors out there, but that's ours.
Mm-hmm.
And they're a great vendor. And, before COVID, we were averaging 9,000 to 10,000 telehealth visits a month in our membership, which is actually a pretty good number, I think. But in the month of March, that increased by 400%.
Whoa.
In 4 weeks. So it went from, say, 10,000 to 40,000 telehealth visits in 1 month.
Wow.
So that's pretty cool.
Yeah.
And so again, think about what that means behind the scenes. We already had the solution available, but boom, the priorities kicked in, the members kicked in, the patients kicked in, everybody just went there, and it was cool. And so I absolutely think, we aren't going to go backwards. I think that's going to continue to be there and grow now that it's a baseline. But, to your question about, what's next and new, I think that baseline platform of telehealth adoption created a whole springboard opportunity for the plethora of digital health companies that are out there eager to get in to the space and grow their businesses, right? And I'm a huge fan, and always have been, of things like precision medicine and digital therapeutics. And I think this creates an opportunity for the companies in those categories to really have an opportunity to grow maybe a little bit quicker than they were before, because a lot of them have just amazing solutions, but adoption is hard. And I think the industry as a whole now is a whole lot more receptive to looking at things like that than they were 8 weeks ago. So I'm excited for companies in that space. I think big data and AI, I think there's a little bit of hit or miss still on AI's, effectiveness. It works sometimes and sometimes it doesn't. And because that's unclear, there's some, some issues there that we still need to work through. But I think that's also going to get a boost through all this. But for me, Jess, I think, all of those are categories that I think have a lot of promise and potential. I think they're going to springboard. But the real, I think, next big aha is going to be the integration of all these into a much more comprehensive approach than has happened in the past, because they are connected. They all need data. They all need, personalized, information, and they all need technology. And I think bringing those together, I think that's going to happen very quickly now. People are going to be paying attention to that. So.
And I think where you're at right there is exactly where it's like everybody's, I feel like that's the topic now that everybody wants to talk about, is like this idea of infrastructure. Like, what infrastructure do we need to build, across, payer, provider, digital health platform, telehealth platform to connect it all together. Like, what are the networks that need to be in place? How does the dollar flow? How do these, how do the things that make it all connect? Like literally like a highway with on-ramps and off-ramps and all of the things, all of the amenities along the way. How does all that like connect? And I think, I just keep hearing over and over again, it almost feels like the tech part of this was proven out. Yes, it can scale. Look what it can do. There's broader awareness for it. But now it's like, I think some of the bigger healthcare organizations, so it's nice to hear you say the same thing. Everybody's looking at, okay, so how do we connect this better? Like, and that's really encouraging. I think it's really encouraging. Yeah. Last thing for you, I think, as far as, GuideWell is concerned, you guys have spent a lot of time, obviously, you and your role, especially looking at, different health technology companies that can be brought in to help, expand care, make it more accessible, bring down the cost, improve the quality. Are you guys going to continue, as this unfolds, is the appetite for going, digital first or integrating more digital solutions, has that grown as a result of this? Or do you think it's like we've hit a point where it's like we've got enough to chew on as it is? Or do you think that this is just going to, you said it would be a springboard, you think, for digital health, but within your own organization, is that what you're hearing?
Absolutely. And again, it's been an interesting, for me anyway, because I come from the tech space, right? So I'm used to innovation, change, adoption, fail fast and learn and stuff like that. Our company...
It's slow for you.
Yeah, but it's just been, I'm so excited to just watch how much GuideWell has embraced all of this. And it's been just an exciting thing to see both internally and externally. And so we're absolutely going to continue to accelerate and move forward. I did want to share though that we actually did already have a lot of this stuff underway. So it's adding fuel to the fire of stuff that was already in play at our company. So we've been reinventing our digital experience from end to end to better meet our member and our customer needs for a while now. So we've been working to deliver an updated experience across all of our customer segments that's intentional, that's easy to use, removes friction, provides members personal and timely information to all of their healthcare information, their claims data, and whatever. So that was already in play. But what I think is really exciting is I think, company-wide, everybody went, holy cow, that stuff they're talking about in the digital transformation, world of our company is legit, man. It's cool. And, the company's beginning to really embrace it, company-wide versus just more in the digital part of our business. So that's been exciting.
We're excited to hear that. We're really, we're excited to hear that. I think from our side of the industry is to hear that, like, not like it's an aha moment, but it's like, oh my God, wow, this really does work. And it can really help with something that's very, something so serious as this pandemic, in terms of really, I feel like it's like digital health, it collectively, telehealth, all the stuff that falls underneath it. It's like, it's got its moment here, with the spotlight shining on it. And so it's good to hear from a big organization like yours that has, that spans the entire, healthcare delivery ecosystem that, yes, okay, good. You guys are impressed with what's been happening so far.
Yeah. I do want to throw out maybe a little word of caution though, because again, we're highly zealous about this stuff and excited about it. But
all right, rain on our parade.
No, it's just a reality check for, some of the companies that are your listeners. I think it's important that even though, COVID has created this really, kind of interesting, even though it came with a bad cost, a terrible cost to our economy and to our healthcare system. It's created an opportunity, I think, for them. But, it's a marathon, not a sprint in our world. And so what I would say is I think that the adoption of telehealth and some of the other digital platforms that are out there, that base will stay. But I do want people to recognize that when the pandemic subsides here in the next few months, hopefully, that there will be a subset of patients that are going to want to go back to having those face-to-faces with their providers. The particular demographics, whether it be culturally or, some of our aging population, they're just more comfortable with that. And so, just recognize that, and our strategy at GuideWell is to continue to serve all of our patients and provide a multimodal channel opportunity for them to get their health in whatever way they want. But that still includes face-to-face, provider sessions as well. So
Absolutely. No, it's just health wherever you, I think the my nirvana at least is the health wherever you can access it, wherever you need it, the convenience.
That's right.
And just having it available to you. Kirstie, thank you so much. One last shout out for the GuideWell COVID-19 Collaborative. You guys can find out more information about that on GuideWell Innovation's website, which I believe is guidewellinnovation.com. Is that right, Kirstie?
That's right.
That's right. Okay, you guys can find out more about that there. Again, the application deadline for startups is May 8th. So definitely take a look at that ASAP. And thank you so much, Kirstie, for letting us pick your brain, not only about kind of like, what went on behind the scenes to arrive at that collaborative and some of the more unique features of it, but also, about the future of virtual care and digital health. I appreciate your perspective.
Absolutely. Well, thanks for having me. I appreciate being here, and I can't wait to see all the amazing applications that we get here in the next week or two. Excited to invite everybody in.
Check back in with you.
Thanks.
I promise you that. All right, Kirstie, thanks so much. I'm Jessica DeMassa with WTF Health. Please check out some of the other interviews that I have done with some of Health Innovation's thought leaders from around the ecosystem about COVID-19 and how it's impacting healthcare delivery all across the spectrum. You can find those at my website, www.wtf.health. Thanks so much for joining us. We'll talk to you guys soon. Bye.